Hello, everybody. My name is Justin Landero, and I will be doing my presentation on the Black Death and its effects on society. So first, we'll be talking about the symptoms of the Black Death. So when contracting the virus, symptoms can lead to a painful, lethal death. Mutations will occur such as fingers turning black and black spots around various areas of the body, as shown above in the picture with the man in the hospital bed. Swelling of the lymph nodes will occur around the armpit and around the groin area and neck area, also known as the bubonic plague. Various physical symptoms include fever, chills, malaise, weakness, muscle pain, and seizures. Ultimately, if left untreated, the bacterium can enter the bloodstream and to the lungs, and which will cause one to engage in a septicemic or pneumonic plague. So as discussed briefly in the previous slide, there are three different variations of the Black Death. We have the bubonic plague, the septicemic plague, and the pneumonic plague. The bubonic plague is where the bacterium infiltrates the lymphatic system, which causes painful and large lymph nodes, known as buboes. Those physical symptoms that would occur would be fever, chills, headaches, and weakness. Septicemic plague is a result of a plague entering the bloodstream, which could have been developed from the bubonic plague. Some of those physical symptoms that would occur are fever, chills, weakness, abdominal pain, and shock. The pneumonic plague are when the bacteria spreads through the lungs. Along with additional symptoms of the other plague, pneumonia is also present, in which is a form of plague that can be transferred from one individual to the next. Those physical symptoms that would occur are shortness of breath, chest pain, fever, and cough. So here's a picture depicting of what the three different variations would affect. So there on the left, as you can see, it shows how the bubonic plague will affect the lymphatic system. There in the middle with the heart and veins, it shows how the septicemic plague will affect the circulatory system. And there on the right with the picture of the lungs, it shows how the pneumonic plague will affect the lungs. So how exactly is it transmitted? Well, the Black Plague comes from a bacterium called Yersinia pestis, founded by a scientist from China named Alexandre Yersin. Yersinia pestis is a rod-shaped bacterium that is deadly due to its ability to disable the immune system. So how is it transmitted exactly? Well, the bacterium Yersinia pestis first infects multiple species of fleas that would then latch onto rats, further transmitting the virus, or also by direct bites to humans, causing outbreaks in the human population. Rats will also then continue the spread of the virus through their population and then ultimately spreading the bacterium to humans after they die. So once humans receive the deadly virus, transmitting then escalates, killing millions of people. So here's a picture basically describing how it is transmitted. So first, the rat will carry the Yersinia pestis bacterium. Then a flea will drink the rat's blood and then contracting the virus themselves. Then the bacteria will multiply in the flea's abdomen. Then once a flea latches onto a human vessel and bites the human, it will ultimately infect the human, causing a terrible sickness. So what effects does the virus have on society? Well, the Black Death spread through many parts of the world, including Europe, Asia, Africa, and even more. The vicious virus became one of the most feared and tragic pandemics ever recorded. The plague forced people to flee their families due to fear and transmission. People had to put jobs and businesses on hold. Many people fled their homeland in search of safety. Doctors feared to treat people with the virus due to the possibility of receiving it. Millions would not survive, leaving trauma at the sight of seeing piles of deceased humans. And sadly, individuals will also starve themselves in fear of leaving their home. So here in these two images, you'll see how the virus was effective spreading through different parts of the world. So what are some treatments to counteract the virus? In today's society, the Black Death is less common due to the advancement of vaccines, antibiotics, treatment from medical professionals, and also better sanitary practices. Furthermore, pest control and food inspection would help prevent plague outbreak from reoccurring. So why is this important, and why should we gain knowledge on this topic? Well, the Black Death has been one of the most deadly pandemics ever recorded in history, taking the lives of millions of people around the world. The virus will negatively alter civilization during the time of its prime outbreaks, splitting up families, forcing people to leave jobs and homeland, and inserting complete fear through society. Although the Black Death is less common in today's society, it is important to recognize that pandemics or epidemics could take off at any time. And without the technology of antibiotics and treatments to counteract it, it could ultimately wipe out half a population if not prepared, which is very scary to think about. Now to finish things up, here's my works cited page with my references. My name is Justin Landero, and thank you for listening.